Good afternoon and welcome to the Epilepsy Foundation of Connecticut. This is our fall webinar series. My name is Monica Anzalone and I will be moderating today's webinar. For the purposes of sound quality, everyone is in listen-only mode, and we welcome you to use the chat icon on the bottom of your screen to type questions, and then at the very end of our presentation today, we will answer those questions. This past spring, we discussed how epilepsy can affect a child socially, psychologically, and behaviorally. Today, we have three great presenters who will be discussing different therapy options to help your children with epilepsy who might be struggling in one or more of these areas. We have Renee Bouffard today, who is a certified equine specialist and a licensed social worker, and she started Healing Hoofbeats, which is her practice there in Hartford. She was unable to be with us today, but we do have a recording of her that we're going to link at the end of the video. We will show you how you can access that link as a part of today's presentation. I apologize ahead of time. I didn't realize that I could not audibly present her recording that she did for us. But that will be linked, and again, at the end of today's presentation, I'll remind everyone of how to go about doing that, and that will be on our website as well for everyone. But we also have with us in person, we have Jona Jeffcoat, who is a board-certified music therapist, and she is the Director of Services for Infinity Music Therapy Services. And we also have Reim Ifrach, who is a board-certified art therapist and a licensed professional counselor, and she currently works for a local private practice called Lotus Counseling of Connecticut. We will begin then today with Jona, and Jona works with children and adults that have developmental disabilities, mental health disorders, and also neurological needs throughout the state of Connecticut. And she has presented on the local and national level on the therapeutic applications of music. Welcome, Jona.
Well, thank you. So yes, my name is Jona Jeffcoat, and I am a board-certified music therapist and the Director of Services for Infinity Music Therapy Services. And I'm gonna try to throw a lot of information at you in a short period of time. So if you end up leaving the presentation today and have any questions, you can reach out to me directly through email, Jona, J-O-N-A, at infinitymusictherapy.com, or via phone or text at 860-518-5557. And please also feel free to look us up on the web at www.infinitymusictherapy.com, or you can find us on Facebook as well. So I wanted to dive in about what is music therapy, because a lot of people think we're kumbaya-ing it around a campfire with a guitar and all of a sudden you feel good and the world's just an awesome place. But music therapy is so much more than that. Music therapy is a data-based allied health profession that uses music and music-based interventions to work on non-musical goals. So while our services may end up having that nice little side effect of learning how to play the piano or play the guitar, that's not our main focus of music therapy. We are looking at things like building self-esteem, improving communication, improving social and peer relationships, working on anxiety reduction, memory recall, and all of these non-musical skills. It really is an interactive use of music. So it's not that we go into our sessions and sing at people. We are making music jointly with them. We are exploring lyrics of songs. And if no one's played an instrument before, that's perfectly okay. You don't need any kind of music background, the ability to play a musical instrument or read music in order to participate in music therapy. You're basically just looking at, does the person have a love for music? Because we can use that to work on some non-musical skills. Music therapy is delivered by a board-certified music therapist. So again, this is an allied health profession. It's something that requires a degree or equivalency in music therapy in order to practice. It's not that we are special educators who also play guitar or speech therapists who know how to play piano. Now, music therapy is a newer profession when you really look at the grand scheme of things. It began around World War I and World War II, where musicians were going into the hospitals, working with veterans, and they were seeing them have a better outlook on life, requiring less medical interventions, and actually had a shorter period of stay. So the music therapy field started growing then, and today we have around 6,000 to 7,000 music therapists in the country. We have about 95 music therapists in the state of Connecticut, and there's about 70 universities that offer at least a bachelor's degree in music therapy. So as music therapists, we have to have a lot of things in our back pocket in order to pull out. So the first thing is we are trained in music, kind of makes sense, right? We're music therapists. So we know how to read and compose and conduct music. We understand music history. We understand different genres of music. Because let's face it, if we get a referral for somebody who likes heavy metal and I show up and I'm playing rap music or country, they're probably going to shut me off and not get anything done in therapy. So our training is across all different genres of music. Yes, I have rapped in sessions. I have belted out some of my screamo, and I have tried to imitate Katy Perry and Justin Bieber, God help us all. But we use a little bit about everything. We're also trained in psychology. So that's abnormal psychology, childhood development, and knowing how the brain actually processes music, because that's key. We need to know how the brain is going to respond to changes in tempo, so how fast or how slow something is, changes in dynamics, the louds and softs, changes in the time signature, so how the music is actually structured. And we are looking at all of those things, how the brain processes it, in order to design appropriate music-based interventions. We are trained in therapy, so that's the assessment, documentation, intervention planning, termination planning, all that good stuff. And again, we have a minimum of a bachelor's degree or equivalency in music therapy. You can get all up to your doctorate in music therapy as well, which is pretty cool. We also have a minimum of 1,200 clinical training hours, have demonstrated proficiency on voice, piano, and guitar minimum, and have the credentials MT-BC, which is Music Therapist Board Certified. So again, it's not just, throwing in a guitar into counseling. We are specialists within the healthcare field. As Monica mentioned, we do work with a variety of individuals. Our practice, Infinity Music Therapy Services, works with children and adults of all ages and abilities. And we have a variety of individuals diagnosed with different developmental disabilities like autism or Down syndrome, neurological disorders like seizure disorders, dementia, mental health disorders like anxiety disorder, depressive disorder, reactive attachment disorder. We work with individuals who've experienced crisis and trauma. So we work with a lot of kids who are in foster care, trying just to make sense out of their world. And then finally, we do general wellness needs. So that might be hooking a neurotypical individual up with an instrument and doing lessons to give them positive leisure skills. Or right now, I'm the only clinician in the state of Connecticut trained in music therapy assisted childbirth. So I actually work with women and their partners before labor and delivery. I use music to work as an audio analgesic, which is pain management using music during labor, and then work on parent-child bonding afterward. So I wanted to pop up a little thing about the brain and music, because music is one of the coolest sensory stimuli anywhere, because it's the only thing processed on both hemispheres of the brain. Music is tied into your memory. This is why you can remember every word to a song you heard senior year of high school, but you probably can't remember what you had for breakfast 3 weeks ago. It impacts your amygdala, so you're having an emotional response to music. It's why we label some songs as being happy or some being sad. Our motor cortex gets up and grooving because our body is rhythmic. We breathe in cycle, we sleep in cycle, we walk in cycle. And if any of those rhythms are interrupted, we have arrhythmia of the heart. We have insomnia. We have a need to go work on our gait because we're not walking right. But music is tied in everywhere, which means that during music therapy, an individual is having multiple opportunities to actually respond to the music that is being presented to them and with them, because again, it's interactive. Gotta love when it does that. Let's see, previous. Sorry about that, guys. I think that was one more. Okay, good. All right, so a little bit of fun facts about music therapy and seizures. There's actually been research that's been done that shows that individuals with a seizure disorder actually react differently to music than individuals without the disorder. What scientists and neurologists believe is that because 80% of seizures start in the temporal lobe and music is processed in the same general area, that their brain is picking up on music in a totally different way, which points to the validity of using music therapy as an effective treatment. Research study found that when comparing EEGs of individuals with and without seizure disorders, that their brains actually synchronized more with the music than individuals without a seizure disorder. And there was also a research study that says while music and music therapy cannot replace, the typical epilepsy treatments like the medication that we're using, that the proper use of music may be able to decrease seizure activity by decreasing stress levels. They have found that stress levels often induce seizures and cause more frequent seizures. And using the correct music and the proper use of music has been found to decrease seizure activity by as much as 24%. Which is just amazing in itself when you think about how powerful music is. Now, if you have a board-certified music therapist who knows how to work on entrainment, knows how to work on using client-preferred music, you can see some of these benefits because we're working along a treatment plan. So we're actually taking data to make sure that the music we're using and the interventions we're using are actually appropriate for that individual. So specifically with individuals who have a seizure disorder, some of our core objectives that we're looking at are stress management, because again, stress can result in seizures. So we may engage an individual in songwriting or progressive muscle relaxation to work on stress management. Now in songwriting, again, an individual does not need to know how to write songs. That is what we are there for. We are helping them figure out how to use music and use music effectively. So we might do free songwriting, which means they come with all the lyrics, or we may start basic with just fill in the blanks. Now, unlike a lot of other types of treatment, we can actually create a finished product, so they can go back and listen to it again and again and again and revisit the growth that they've had during music therapy. Progressive muscle relaxation is a method of tensing and releasing the muscles in time with music. Now, a lot of times if you look up Spotify for music therapy songs, which again, there's no such thing, you see all the Bach and the Beethoven and the New Age, again, all this, we'll call it the hippie music because that's what a lot of the general community looks at it is. It's all this music that's being used for relaxation. The reality is, if the music does not jive with your own body, it's not going to be effective. So as a board certified music therapist, I may use R&B, I may use rap, I may use pop, or I may use country for progressive muscle relaxation. We might work on self-expression using art paired with music or creating music videos. Now, Emily's going to get into art therapy in a little bit, which I'm super stoked about. So the big difference when we start combining art and music together is that we are looking at the music responses and how music is driving the art. We're not looking at the art piece as music therapists. And Emily's doing the opposite. Emily's looking at the art component of it, and the music is just supplementing. So we're good companions as creative art therapists, but we are not replacements for each other. Now, self-esteem, a lot of our individuals who have a seizure disorder often have decreases in their self-esteem because they're missing school, their grades are dropping. Maybe it's interfering with their ability to interact with friends. So we look at building up self-esteem by using, adapted music lessons to give them something positive to work back towards. And as music therapists, we know how to adapt the music based upon their memory needs or their motor needs, especially if there's a dual diagnosis going on that is also impacting their motor coordination. We also might do lyric analysis. Now, lyric analysis is when we take a song, we start breaking down the words of that song and discussing basically somebody else. We're removing it from ourselves just enough in order to dig in deep to what is really going on with us. And when an individual is ready, we generalize those skills over into their own sense of self. And finally, we might work on memory recall, doing things like therapeutic instrument play. Now, in a session, we may bring in drums, we may bring in guitar, shakers, recorded music, you name it. We're bringing in a lot of different materials. All right, so just really quick, because my time's about up here. Infinity was founded in 2010. We do provide in-clinic services in Southington and New London, but we also do in-home, in-facility, and in-school services throughout the entire state. So we travel right out to our clients wherever they're located, and we serve a lot of clients in their homes, in nursing homes, in adult day programs. So we go about everywhere. And we are a national training site for music therapists. I provide supervision for clinicians across the country, as well as run 3 different internship programs. And our program is a highly customized treatment team, full team approach. All of my clinicians meet a minimum of 1 time a week. We all discuss cases together. We try to co-treat when at all possible. And we've been very, very blessed to work with the Epilepsy Foundation to offer groups specific to individuals with seizure disorders. We also have worked under the IEP for children who are receiving special education services, through the IFSP for children in birth to 3, and we are a DCF approved provider. All right. So we like to keep a treatment plan. We look at our treatment plan every 6 months, and we are taking data after every single session to ensure that what we are doing is appropriate for you rather. And we try to really hard to match our clients with clinicians based upon location, schedule, need levels, and overall personality. We're not just assigning you to whoever we have on staff. We try to really go beyond that. So if you're interested in more information about music therapy or working with us, what you would do is you would call us, again, 860-518-5557, and we would set you up with a free consultation to learn more information about music therapy and how music therapy might be working with that particular individual. We usually conduct 1 to 3 assessment sessions to gather 60 to 90 minutes worth of information. And finally, that assessment report is written up by an MT-BC. So again, music therapist board certified. The report is then approved by myself. Again, full team approach. You get a copy of the report, and services continue until we either recommend termination, you decide you'd like to pursue other options, or we look at that all the goals and objectives have already been reached. All right. So thank you so much for listening. Again, if you have more questions, my information is down there at the bottom. Please do not hesitate to reach out. We have hooked families up with various funding sources around the state, and we offer a variety of group services in clinic to also try to keep costs of therapy lower. So hopefully I can answer questions for you in the future. I'm going to turn it over back to Monica, I believe, so she can get Emily set up.
Okay, so now we will be hearing from Miss Emily, who is a board-certified art therapist, and she's also a licensed professional counselor who works currently for the Lotus Counseling of Connecticut. And there she treats clients specifically that have eating disorders, as well as complex trauma and body image issues. Emily has had the privilege of working with Jona, which I believe was mentioned earlier, at Infinity Music, running Studio E, which is an epilepsy self-management program, art therapy program, and it is for adolescents specifically that have epilepsy. So I will now turn it over to Emily.
Thanks, Monica. Hi, everyone. So I'm Emily. I'm a board-certified art therapist and licensed professional counselor in the state of Connecticut. And today I am just going to go over a little bit about art therapy, what it is, how to find a qualified art therapist, how it applies to adolescents with epilepsy, and how you can find us, if it'll let me. There we go. So what is art therapy? I have a whole big fancy thing on this slideshow. So essentially, art therapy is a psychotherapeutic or mental health profession. Like Jona was saying, like music therapy, it's an allied health profession. We use art and the creative process and the artwork that's made to delve into many different issues, exploring feelings, reconciling emotional conflict, talking about self-awareness, self-esteem, body positivity, reducing anxiety and depression, a multitude of symptoms. Art therapists that work with autism also do a lot of behavioral work. Art therapists that work with children with disabilities might also work with an OT to support fine and gross motor skills. We're trained in diagnostics and in art assessments, and art assessments are different than your usual psychological assessments because they utilize art with specific markers. Now, you don't need to be an art therapist to do art assessments, but all art therapists are trained in them. And because of our training, we usually find that we're the most qualified to do them. So art therapy practice requires us to have a knowledge of all the visual arts, drawing, painting, sculpting, textile arts, understanding the creative process, and also then being trained to be a licensed professional counselor. So human development, basic psychology, child psychology, the brain development. Because I specialize in eating disorders, I've had a lot of medical training, counseling theories, and traditional therapeutic techniques such as cognitive behavioral therapy and dialectical behavioral therapy. Let's see, there we go. So who benefits from art therapy? Well, in my personal opinion, we all benefit from any kind of therapy. So if you're not in therapy, you should be, because therapy is better people. So art therapy is practiced across a wide range of fields. We're in mental health agencies, rehabilitation services, hospitals and medical offices, educational and school settings. And in Connecticut, we find art therapy in the judicial system, working with DCF, working with the courts, working in prison. And most art therapists provide a wide range of services, including individuals, couples, family therapy, and group therapy. So art therapy is an effective treatment for people experiencing a multitude of issues, be it developmental, medical, social, psychological. On average, the individuals that we find that benefit best from art therapy are those who have survived trauma, resulting from either combat violence, domestic violence, sexual assault, abuse, natural disasters. We see people with adverse physical health conditions, cancer, traumatic brain injuries, and other forms of physical disabilities, autism, dementia, depression, and other mental health or psychiatric issues. And we also see clients for the treatment of eating disorder and for epilepsy and seizures. So why should you choose art therapy? You should totally choose art therapy, music therapy, any kind of creative therapy in general. In my work, I found that the biggest thing is that traditional talk therapy has either been difficult for a client or unsuccessful. Not because the therapist isn't successful, not because talk therapy is a bad thing. As a licensed counselor, I also do talk therapy, but because for a lot of clients, especially clients with epilepsy and seizure disorders, if there hasn't been a disruption in their ability to communicate, right? They spend a lot of time talking about their seizures. They spend a lot of time talking about being sick, their medication, all their appointments. So a creative therapy is an opportunity for someone to get help and not have to retell their story again and again and again. Sometimes for adolescents, verbalizing issues are difficult. In my work, personally, I focus on the art giving our clients a voice. So how can we potentially have an hour session where all of our communication is through the art, where someone feels heard and witnessed and understood and responded to without ever having to utter a word. Creative therapies like art therapy are both interactive and dynamic. They kind of keep the brain stimulated for the entire time instead of having lulls and brain waves kind of shutting down a little, maybe not taking in the information as much. And clients can learn all the same traditional therapy skills, so CBT, DBT, coping skills, through art therapy. So you can get for example, I'm being certified in trauma-focused cognitive behavioral therapy. You can do that with art without talking. So it gives clients different kinds of options. Art therapy can improve self-esteem and self-confidence, a stronger core of inner strength, gain greater insight into their self, their current issues, create a stronger bond with their bodies, which I think is so important with seizures, right? So you have epilepsy, you have your first seizure, and you don't know your body anymore. You're not in control of your body, of when it happens. You know, doctors will work with you to figure out, you know, what are your triggers? How can we control those? But ultimately, there's a level of autonomy that you've been robbed of. So art therapy can help recreate new connections to your body and to your autonomy. Okay, so finding a qualified art therapist. This is really important. It's important because while any therapist can make art with their clients, and I want to make that really clear, anyone can draw with their clients or make art with their clients. But if you're not a master's level trained art therapist, you don't have the skills that one needs to be able to assess, diagnose, read the art, and treat someone with the art without potentially causing harm. So that sounds a little extreme to people, and I get that. But my biggest example is if a client comes in the room and they've had sexual abuse, right? And I think, ooh, clay will be fun. It sounds like a good idea. Clay's fun. I like being messy. Well, if their sexual abuse was from the age of 10 or younger, there's a chance that clay will really trigger them because it's a very juvenile object and it really kind of, you know, it smells like mud and the taste and the texture and the smell, and it can trigger someone into a full flashback. It's not something that the average person would know. You need training in the full continuum of art materials, as well as psychology and therapy. So to be an art therapist in the state of Connecticut, you have to have a master's degree in art therapy, expressive arts therapy, or creative arts therapy. And you have to be qualified for credentials through the ATCB, which is the Art Therapy Credentialing Board. You can also be trained through the International Expressive Arts Therapy Association, and their credential is a little different, but still valid, and it's valid internationally. So some good questions that you should ask when you're looking for one of us is to ask what their master's degree was in. If someone tells you their master's degree is in clinical psychology, but they're telling you they're an art therapist, there's a good chance that they're not, but that they have a certain set of skills to use art, but not in the way that one would look for an art therapist. And you want to ask if they're credentialed through the ATCB or the IEATA, and what those credentials are to make sure the person has enough education to be able to speak to you professionally and appropriately about what they're about to do with your child. So continuing. So different credentials that you're going to see pop up as you search for art therapists. So now there are essentially 6. So through the Art Therapy Credentialing Board, there is the ATRP, which is a provisionally registered art therapist, the ATR, which is a registered art therapist, the ATRBC, which is a board certified art therapist, and the ATCS, which is a credentialed supervisor. And then if you go through the International Expressive Arts Therapy Association, you have 2, the REAT, which is a registered expressive arts therapist, and the REACE, which is an expressive arts consultant or educator. Anyone that has those credentials or has the education to gain those credentials are qualified to treat your child. So what should you and your children expect in session? So it really kind of depends whether it's an individual or a group session, but the idea is to help elicit the client's inherent capacity for art making to enhance their well-being. So in a typical session, usually for me, a client comes in, they say hi, we meet each other, hopefully we've done an intake and now we're ready to kind of get into the art making. So before our clients come up as art therapists, we already assess what materials and directives are appropriate based on what they're dealing with. You can expect anything from painting and clay and something super messy to textiles, quilting, sewing, knitting, drawing, you name it, we do it. But we're only going to do what's appropriate based on our assessment of what you need. So art therapy and epilepsy. So due to the nature of epilepsy, many clients kind of live with feelings of being stigmatized, having low self-confidence, maybe missing out on important life events, feeling trapped by a diagnosis. So historically, through my time with Studio E, art therapy's provided a lot of things for those clients. Development of interpersonal skills, resolution conflict, behavioral management, improving autonomy, stress reduction. Art is empowerment. So finding your voice, kind of helping you relearn who you are. So you were this person, and then you have your first seizure, and then you're not this person anymore. And I would imagine at 13, when you're just figuring out who you are, that's a pretty low blow. Because being 13 right now in this world is hard enough without you having to kind of relearn your entire identity. So the idea is that art kind of helps them relearn that identity, relearn skills, regain stability and a sense of self-worth, and allow clients to separate themselves from their diagnosis. And most people's experiences that I've talked with epilepsy, for not just the child, but the family, it's appointment after appointment after appointment, waiting for the next seizure, hoping it won't come, hoping this medication will work. So the time in session is also a time to not have to worry about those things, and to have an hour, if it's your only hour during the week, whether it's the child or the entire family, to kind of feel some relief from that pressure. So thank you for having me. I hope that you learned a lot. You can reach me, as you see at the bottom, at my email at rhlc@gmail.com, or you can reach me on my work phone at 203-441-5450. I'm based in Watertown, Connecticut with Lotus Counseling of Connecticut. I also have a small practice in Hamden where I do group therapy and clinical supervision. So thank you.
Okay. As I discussed earlier, we wanted to have Renee Bouffard here to talk about animal therapy, but she was unable to attend. We do have a recording that we're going to link to this presentation, which will be available on our website, where you'll be able to see and hear from Renee. And this is her information here that I just put on the screen. She is a certified equine specialist as well as a licensed social worker, and she started her own business, which is called Healing Hoofbeats, which specializes in working with individuals, couples, families, and groups through equine-assisted therapy. And Renee specifically specializes in complex and single-incident trauma, reactive attachment disorder, depression, anxiety, autism in individuals of all ages. And she's also trained in EMDR, which is eye movement desensitization and reprocessing therapy. And if anyone listening to this has a child that has psychogenic non-epileptic seizures, this would be a great resource for therapy for them, since therapy is the only real choice and solution for psychogenic non-epileptic seizures, and that EMDR also has been a great and successful treatment for that type of seizure disorder. So that's just kind of a side note there. And again, we will be linking a YouTube video with Renee's presentation once this is all completed. So you all will have access to that. Now we will open this up for questions. If anybody has questions, you can go ahead and type that in the chat section at the bottom of your screen, and one of the presenters, either Emily or Jona, will go ahead and answer that. So we'll give you a few minutes there. I definitely found both presentations helpful and interesting, and I loved how you really kind of honed in on that this gives an individual the opportunity to express themselves in ways that maybe is not a part of their normal life as someone that has epilepsy, because they're so focused on appointments and treatments and am I going to have a seizure today, and just their life ends up being so focused on their epilepsy, which we certainly hear so frequently, that this is an opportunity for them to kind of break outside of that and kind of speak to, like, well, who am I outside of this medical condition, because that's not all that they are. So I really liked how both of you really focused on that in your presentation. So it was really good. I appreciate your time and your expertise. Okay, so if we don't have any questions, I don't know, Jona or Emily, do either of you have anything else to add?
Is there the potential for people to be watching this outside of Connecticut?
Oh, yes.
Okay.
Yeah.
So I love, Emily, how you chimed in about how to find an art therapist. So, and I didn't include that in mine. If you're outside of the state of Connecticut, what you can do is go to the Certification Board for Music Therapists, which is www.cbmt.org, Certification Board for Music Therapists. And there's actually a menu that will tell you if somebody is board certified if you look for their name. The other option is to go to www.musictherapy.org, and that is the National Music Therapy website. So that's our American Music Therapy Association. And you can contact them directly and ask for a list of therapists in your area. The only therapists you're going to get are people who are members of AMDA, which is not a requirement for being a music therapist, but you will get some information. And then please, I network like a beast, like with everyone across the country. So if there's a particular area that you're looking for, I may know a colleague who's over in your area, or may know of a colleague who knows of a colleague. So don't hesitate to give me a shout as well. I want to be a resource for you and your family, even if that's not providing you direct services, not hooking you up with somebody who meets your family's needs a little different than we do.
All right. Thank you, Jona. And here at the Epilepsy Foundation of Connecticut, they mentioned Studio E, the art therapy self-management program. This is something that we do frequently throughout the year. So if people are interested in that program specifically, contact us and we'll let you know when the next session will be. Our website, you can get more information, is epilepsyct.com. And that is also where you will find a recording of this webinar, and then also the recording of Renee Bouffard speaking as well about her specialty in animal therapy and her as a licensed social worker too. Okay, well, on behalf of the staff at the Epilepsy Foundation of Connecticut, I thank you all for joining us and taking the time to view our presentation today. And thank you to Jona and Emily.
No problem. Thanks for having me.
Thank you.